Yes.
Start now.
Namaskar. Jai Mata Di. Jai Santoshi Mata. Today is Friday, Shukravar, and it's quite cold here in London also. Plenty of snow still there. Can't go out. Very slippery, very slippery. So I am back to my Zoom classes again. We have closed all the classes. So I feel quite happy rather to be with you every day now, except Tuesdays. Lovely. Thank you very much once again. Let's sit straight. Keep your neck straight, spine straight, shoulder behind. मन सहज, आंखें बंद. ध्यान मुद्रा में बैठकर लंबा गहरा सांस लेंगे नाक से और मुंह से 3 बार पवित्र नाम ओम का उच्चारण करेंगे. ओ ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्. ॐ सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःख भाग् भवेत्. ॐ शान्ति शान्ति शांति. Let's all pray to Almighty. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, or financial. With these good thoughts, we will start our session of yoga, keeping in mind all the precautions. Do as much your body allows. If you are suffering from hypertension, heart problems, severe acidity, severe asthma, severe backache, please do it slowly. We have to do it. But again, today, as this session we are going to do on the plantar fascia problem, that tells us even the exercises we are doing, we have to be very, very careful. So, keeping in mind all the precautions, I will touch this subject again while discussing. I am waiting for Varsha to join. She told me last night she will be joining us after 9:15. So till then, we are going to warm ourselves up nicely. Today, how I am going to warm myself? I am not that active. Especially we are talking the people who are suffering from diabetes, various type of arthritis. They are very weak. So sitting on the chair, you can do so much. Let's do our warming up with what? Anybody can guess? Something entirely different. Entirely different. Boxing today, boxing. So make a fist and move your arms At the same time, main attention is on our breathing. So Bhadraka Pranayam, breathing in and out from the nostril, mouth is closed, though I am talking, I am allowed. So start gently, boxing, and go on breathing in and out. Boxing. Very, very gentle, slowly. I'm very weak. I hardly move, but people say, my friends say, you have to move now because otherwise you will be stiff and you won't be able to do anything. You will be cabbage. So carry on boxing. With a smile, start slowly, then medium speed, and then we'll be going on to fast speed. Boxing. Just imagine you are standing in front of me and we are doing boxing. Full attention is on the breath. Bhadraka Pranaya. Come on. Carry on. Come on. This side. Punch. Punch. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Punch, punch. You are standing in front of me. Boxing. Come on. Do your own at your own pace. Carry on. Someone is talking, you are doing with me, I think. Amit. Come on, everybody. Come on. Punch. Banu Bhan, punch me. Go down. Now move your upper part of the body also. Punch. Well done. I can watch you now. See how much activity is happening with simple things. You don't have to do complicated. Now we are going sideways. Give a punch. Sideways. Punch. Boxer, we are boxer. Carry on. But slow, then medium, then fast, depending upon your stamina. If you do this for 5 minutes, even when you are in the bed, don't want to get up. But Swamiji says, even if you don't want to do, you have to do it. भाव कुभाव, भगवान का नाम लिया जाता है भाव से कुभाव से. Even then he accepts that. Same thing with the yoga practice. दिल नहीं करता आज कुछ करने को, इतनी ठंड है, पर करना है, इस शरीर को चलाना है. पंच चलाना है, इसको, ये गाड़ी को चलाना है. बेड में थोड़ा पड़े रहना सारा दिन. ठीक है, बाहर नहीं जा रहे. Come on now, down. Punch. Well done. Punch. Then come on the face. Give it bash on the face. Come on. I want to win. Other one. Move your neck now. Neck movement. Come on. Punch. Boxer. All boxer. Other side. Right, take. This side. See, all the movements are occurring. The neck movement, shoulder movement, arm movement, and the trunk and the heart and the lungs, everything is moving. And the abdominal organs also moving. Whole body. Oh, come on. Give a good punch. 1, 2, 3, 4, 5, 6. Then do on the head. We do on the head. Just imagine the head is in front of me. Bhanu's head in front of me. Come on. Money is also there. So many, my friends. Come on. Punch. On the head. Other side. Come on. Then on the tummy. Come on. On the tummy area. My person I'm fighting with you. Carry on. Now, if your body allows you, do it fast now to get the more benefit. And the breathing is going on side by side. 7, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6. Come on, sideways. 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 What else you have done? You made the fist. What is your mudra? Adhi mudra. Benefit of Adhi mudra. So we're getting the benefit of Adhi mudra, which is going to expand my lungs, plus good for my sleep and increasing the prana. Come on. I think you've done quite a lot. Let's carry on now. Relax now. Relax. You've done good warming up and a good exercise. Now sit straight. Lift up your spine. Take a long deep breath from the nostril and exhaling from the mouth. Our heart rate is gone up. Respiration rate is gone up. That is a good sign. That is the aerobic exercise we have done, which is very good for my heart and for my lungs. Increase more your prana. Look down, exhaling from the nostril, spreading your arms, coming up slowly. You are breathing in now as we are coming up. We are asking for the blessing from the Supreme Power. That's what we are doing. When we say Radhe Radhe, Radhe Radhe, Radhe Radhe, Radhe Radhe, Radhe Radhe, that's what we are asking for the blessing. And we are surrendering. We are surrendering. That's what surrender has to be done in the Lord at the what is surrender? That is one of your step of Ashtang Yoga. Ishwar Pranidhan, full surrender. Yam Niyam, that is their Yam Niyam. And that comes in the Niyam category. Surrender to the God. Here we are surrendering completely. That's what we do, you know. Get the blessing. Until unless you surrender, you won't get anything. Zero. So surrender always. Surrender. मैं तेरा तू मेरा. मैं तेरा तू मेरा. That is the idea of doing yoga, samadhi. Getting into the union of Atma with Paramatma. That's what we are doing, surrendering. आओ मेरे को संभालो. I am nothing without you. I am nothing, nothing. Breathe in. First breathe out. We are going down. Breathe out. Then breathe in, coming up very slowly. Spread your arms up. Ask, surrender, and then again breathe out from the mouth fully. Surrendering. Ishwar Pranidham. One of the step of Niyam. Yam Niyam, Asan Pranayam, 8 steps of Ashtang Yoga. That is going side by side. Is Varsha has come or not?
I'm here, darling.
She's not here?
I'm here.
Yes, she's here. She's here. Okay, Varsha, we were waiting for you.
Ji.
Okay, thank you very much for asking me this subject. Now, all of you can see the photograph of this problem. Try to look very carefully. What is this? I will stand up. Don't worry if you can't see me. See at the picture. That is your area of your sole of your foot. Yes, you can see white thing going on. That is known as fibers. The fibers are running from the heel up to your toes. Yes, everybody is looking at that. Plantar fascia. Plantar means the sole part, the lower part on which we are standing touching the ground. This is running from the heel up to your toes, all the toes. Plantar fascia. This is a fibrous bands which are very important because they are also our shock absorber. When we do sudden movement of the foot and like a shock, they observe that so that there is no damage. But the problem is when it gets inflamed because of the overactivity, bad posture, and various other causes, it gets inflamed. That is known as itis. Plantar itis. There are two words. Plantar fasciitis. Itis means always inflammation. We say for many things. Bronchitis, inflammation. Uveitis. Then you can diverticulitis. ITIS means inflammation. And that happens when we misuse the part. So when there is inflammation, this will be happening. Now you are seeing this fibrous tissue. They are all bands, and they stretch very easily. So if you overdo exercises, you can damage it. And there are various other causes for that. When it gets inflamed, now look at this picture. This is what mainly the area is. You can see that inflamed area near your heel. Most of the time this happens, that area of the fibrous tissue is overstretched, overactive for various reasons and get inflamed. But it can spread further. Look at this. The whole foot is red. So the whole foot is involved. This can be quite serious condition. Okay. Now I have shown you various types how it can happen. Sometimes it can come in the back of your heel also. That is a tender there, known as Achilles tender, which get inflamed, and that can also cause you this problem at your heel. Now, who are the people suffering from this? The people who don't wear proper shoes. They can get this very tight shoes, very pointed shoes. They get this condition, and then there is some mechanical fault with our foot, which we can be inborn also. We are born like that. There are no arches. We are flat foot, or we have got very high arch of the foot. So those people can get all this. And the people, as we say nowadays, especially to the people who are especially diabetic wear shoes whole day. But again, mind you, if you're wearing the shoes whole day, you're not doing any exercise of your foot, and you might get damaged. The skin of the foot is damaged, and then we recommend, please try to walk barefoot, but watch where you are walking. The floor shouldn't be very cold, because when the feet are very cold, you get more pain. So you have to be very careful. Make sure the temperature is enough there. Nowadays, most of the people have their marble floor. Wooden floor is all right. They are slightly warm, but luckily many rich people, they have under the floor heating, you know. So try to walk on the floor barefooted, but make sure not on uneven ground or hard surface. The people who walk on the hard surface and do exercises, they are getting this problem. They are doing too much exercise. And other thing is they're walking too long, or they are sitting too long, or they are doing jogging. They are suffering more from this. And again, they say it can be even age related. It can happen in early age also, but the average age is 40 to 60 years old, and this is more common in the female. Why? Because we wear fashionable shoes, high heel shoes, very tight forefoot, and we are working on that the whole day. So we will get that. And plus other thing is maybe most of us, except few of us, working more in the kitchen, standing for a long time. So standing long time, walking long time, sitting long time, they can all cause this problem. Other thing is, you know, if suddenly you put on too much weight, overweight can also cause this problem. So we have to look after all these points. Look at your shoes, the way you are doing your exercise, and whenever we start any exercise, please consult your physician to make sure that it's suitable for you. And always start with a short time doing exercise, and slowly and slowly you can increase your exercises. Okay, so you're still looking at the inflamed one. Okay, the next thing is the treatment. What is the treatment? See, there are physical exercises you can do. You can do physical exercises. And if the problem is quite severe to moderate, then try to rest. You can put ice pack, even ice cubes, you can put it there because that will take away the inflammation. And then do exercises. They are very, very important. Exercises. Exercises are very, very important. And other thing is, we ask you to look at your shoes. When you buy the shoes, measure your foot and try to have a little bit loose than the tight one and not very pinpointing shoes, you know. And then you consult the foot specialist and they advise you about insole also. There are soft pads you can use. The exercise, there are plenty of exercises we can do to get better. And then looking at your lifestyle modification. First of all, if you're overweight, try to lose weight. Try to lose weight. So we will be doing some asana for that also today. And other thing is look at your shoes, the way you are walking, and try to change your shoes early because they get worn up and then they give you problem. Then if this doesn't help you, then you have to consult your doctor if it is persisting because that is making you not to do your daily work. Then he can advise you to refer your physiotherapist and the foot specialist also. They will help you and there are various treatments are done, but most of the time you can get better by doing various exercises. So we will touch the exercises now. Come on. Now going to exercises. Coming to exercises, I have got one of your yoga teacher, very experienced yoga teacher who is having this problem. She will help us to show you various exercises, what to do. But usually we start while sitting even. While sitting. Okay, can you? We will start sitting first of all. Sitting. Now I am getting up from my, just woken up, and I am having this problem. As soon as I go down on the floor, I got shooting pain. So I know myself. So you can prevent that by doing massage on your foot. Start doing massage on your foot. You can do any way from up to down or down to up, because this is the I am massaging.
We can't see you properly, Kapurji.
Yeah, that's what we are trying. Yeah. Now you can see me?
Yes, thank you.
Yeah. This is your foot. You are still in the bed. You haven't come to the ground, because I know I get shooting pain in my heel or whole of my, this area, sole. So I will do massage. Put some oil. Any oil will do, mustard oil, coconut oil, sesame seed oil. And they say if you put lavender oil with the olive oil, that gives you better effect, because lavender is known to take away the inflammation. So you are doing your massage. You are still in the bed. Do nicely, like this also, all around. Doing your massage. And come to your toes also. Each and every toe. Do the massage there nicely. And you have to carry on for some time doing massage. You're going to do both the feet. And spend more time where there's more problem. So you're carrying on longitudinally like this, and then sideways. Okay? You have done this. Then again, as we do up and down at the ankle, we are doing. Now what is happening while doing this? You are increasing the muscle strength, which is holding my foot, and that fascia is getting activated. Up and down, up and down. Just hold at the toes and down. And the same time you are doing your breathing exercise also. Pranayama is going on side by side. Then you can do your rotation. Well done. Now, if the things are very bad, then I will recommend have your water-filled bottle with the ice. That is frozen water bottles. How you can keep in the morning, yes, to put in the ice box. It can stay. And then you can rub it nicely. That will also help you take away the inflammation and the pain. You can do front and the back also. Nicely, this is, just imagine this is my bottle. This is my bottle, which is full of frozen ice in the bottle. So put it there like this. Okay, you have done this. The next one is other exercises. Now we are going to do, first one is the towel. Pulling your towel. Towel. pulling your towel.
Okay, hello everybody. Can you get rid of the back? It's gotta be. Okay, so I'm just showing you what. No, it can't. Because you can't see it because it's covered by the thing at the back. Covered by the background.
Towel, it's a This is a towel.
Okay.
Towel. Come on. This is the towel underneath your feet.
I can't see the towel.
I know. Towel. Get rid of towel.
You just have to get rid of the background. None.
Okay.
Right.
Sorry,
Okay.
dear. Come on. Now.
Okay, so this is what we're doing. If you come to the ground, you put a towel here. So there are 5 things that I do. So I've been having this problem with my right foot since September. So I've been doing this and it's got much better. So I'm just going to show you the 5 things that I do. So one thing is having the towel and putting your foot on it, like so. And then you're just bringing the towel together using your toes. So it's much harder when you're doing it on the carpet because it doesn't move so much. But the point is to get your toes to move. So I do that 5 times on each foot. And coming on to the other side, I don't have the problem so much on the left side, but I still do it. So you can see trying to drag the towel with your toes. And like I said, if you are on the wooden floor, it's easier for the towel to move. On the carpet, it's much harder. So you do that 5 times on each side. And you do that maybe 2 rounds. So that means you would be doing 20 in total, but as much time as you can is good. So that's one thing that I do. And then another thing that I'm doing that you might like to do when you are coming out of the bed is I lift up the foot, hold the, this is the best way, hold the toes and bring back the toes as much as possible. Because again, we are trying to stretch all the way from the toes to the heel. So try, of course, to keep your back up, shoulders down. You can be doing your nice deep breathing. You can do that for 10 seconds. And then bringing the toes back to the front. And then do the other side. So again, clasping your toes, pushing them round. And of course, the first day it will hurt. Second day it will hurt less. Each day it will hurt a little bit less. So again, you're holding it for 10 seconds. So that's 1 round, 1 foot and another foot. And then I would definitely encourage you to do 2 rounds. Then we have this thing, which is, it's on your stairs. So I thought I would just show you like so, but I think this is a really good one. So, you know where you have your steps coming up? So I'm going to pretend this is steps. So you come onto your steps and then you go down and up. Down, and like you can use something to hold you up when you come down. So you're on your steps, on your staircase, and you're coming down. Because when you're coming down, you're opening up the backs of your calves and your heel. Coming up, and then you really want to come down. So like I said, you're doing this on your steps, coming up, and then coming down. And again, it will definitely be a bit painful first couple of times, but then you will begin to enjoy it because you're actually feeling the release in your calves. Feeling the release in your calves. And if you can, I'd encourage you to do 10 of these. I think 1 round of 10 is enough because it's quite intense. Of course, if 10 doesn't work for you, you start with 5, slowly building up. Come as low as you can. And as always with your asanas, notice what effect it's having on the body. Everybody's effect will be different. We all have different bodies. Very good. And then my favorite one, because I think it has the most release, Mum, can you hold that? Is this one. Okay, so, well, where's the best way to show this? No, let me see the whole body. If you go back. Okay, no, can you hold it? Can you hold it like that? Okay, so what you're having here is you've got a flat wall and you bend your left knee. So it should be at a right angle. Lower, please. Lower, please. It's okay, give it to me. Okay, so your knee is at a right angle. And then your right leg is straight. And all you're doing is pushing your weight against the wall. And you will feel the back of your right leg opening up, your hamstrings, and again, your shins. But try to keep that left knee at, it was fine, please leave it. Yeah, that's good. At a right angle. And then you switch and do the other one. So again, right knee is at a right angle and you're opening up the back of the left leg, opening the hamstrings, opening the calf muscles, pushing forward. You can hold this for like 10 seconds. So I find this the easiest one because you're always passing a wall. So very easy to stop and do. And again. And want to make this one a little bit more intense, you can take your towel and wrap it up, because these are really a selection. You will figure out what one is really impacting your body the most. So let's put this back here. So I'm going to bend again my left knee. I'm going to place my right foot onto the rolled up towel. Again, leaning forward. So opening up through the back of the right leg, so the hamstrings, calf muscle, and now my toe is slightly lifted. And you can compare with and without, see what works for you. If you can do this one, I would recommend it because it's really picking up your toe as well. And again, you're holding this for 10 seconds. So these are the exercises that I've been doing. I noticed a difference within 2 weeks. I did them in the morning and in the evening. So when I woke up and when I was going to bed, I noticed a difference after 2 weeks, a little bit during, but after the 2 weeks. And then just to remind you what they are. So they are pulling back when you're sitting, holding that 10 seconds, doing it on the other side, holding it for 10 seconds. If you can do that 2 rounds. Then there is the one with the towel on the ground, oops, which is really quite hard to show. It's the towel on the ground, and it's hard for you to see it move because we're on this is 2 piles of carpet, but you can see you're trying to get your toes to pick up the carpet or pick up the towel and move. So really opening up this part of the toes. Then the other reminder was to come onto your steps in your house. You can hold yourself up, lower your heels to the ground. Lift and raise them to the ground. That was the 3rd one. The 4th one is arms up against the wall. Try to keep the front knee just at right angle, stretching out the back of the straight leg on the other side. And then the slight modification to roll the towel and place it under the toes. So when my mum said she was doing this, I offered to show because I know that these have worked for me. So it doesn't mean they're going to work, of course, for you, but you will find the ones that have the most effect on you and you can try them out. So now I've been doing it for 2 months and I think the pain has basically gone from the left and there is a little bit in the right. But I think without these exercises, that would not have happened. I don't see why it would have gone. So I encourage you to give these ones a go. And then, like I said, you will see which one is working for your body. Thank you, everybody, for listening and allowing me to join you. Thank you, Mother.
Okay, thank you very much, everybody. So you have seen some. I will show you a few more. There's so many, you know, so many, not 1 or 2. There's so many. Oh, come. Okay, let's start. Bella has shown you, as I said, Bella is one of the yoga teachers. She is more international than me, you know. Other things you can do. Take the cricket, tennis ball. They are very good. Tennis ball. Any hard ball you need to do the exercise we are doing with the, this is the tennis ball. Okay. Put it underneath your foot and just go on doing this. You can do with tennis ball, forward and backward. Now, Varsha, at the same time, we are doing our knee exercises also. This is going to help for my knees also. So, most of the exercise, the one you have seen touching the wall, which Bela has done, that is also good for the knees because you are making your calf muscles to work better and the other muscles of the thigh, hamstring and the quadriceps, they are working better for the knee joint. So these exercises do help for the knee also. So we are just rotating this tennis ball underneath our foot, that area of our plantar fascia. The plantar fascia, we are making it active. Now you can do circular movement also, like this. Yes. Circular movement. You can do both the feet. If there's problem in both the feet, or you can do it short time, the foot which is having no problem. Because this is known as preventive medicine. Whatever we do for prevention, not to get it. So, forward and backward, then rotate and repeat this. Do for 2 to 3 minutes and repeat during the day also when you are sitting watching television. Or nowadays the people can talk on the phone also because they've got that ear things. So this is the one. Now you haven't got tennis ball in the house, let's say. So you have got these canned food tins. You can use this also. See? Come on, you can also get your tins now and do it. See, backward and forward. Very good. Carry on. Backward and forward. You're doing your knee exercise also. Side by side. The ankle, the foot, the knee. The other one. See? Put on nice music, lovely bhajans, and go on doing it. So easy. Now you haven't got tin food also in the house. You don't believe in that. Then you can have your rolling pin. You can do both the feet together on the rolling pin. Or you can have thermos flask. They are also good enough. Or you can have the frozen water in the bottle. This you can do on this any cylindrical object. You can do like this, doing both the feet together. This is relaxing my calf muscles also. Because many times when the calf muscles are very tight, you can get that symptom of pain at your heel or whole foot. So we have to look after our calf muscles. And the exercise you have seen against the wall done by Bela, they are for releasing the tension in your calf muscles. Good for the knee joint also. Carry on. Carry on. You are enjoying yourself. Yes, I can see that. So these are the very important exercises. Anything in the house. We all got rolling pin. We make chapatis, isn't it? Rolling pin you can use. And then you can do your arm exercise also, side by side. Arm exercises. Because we want to lose weight. The problem has occurred because I have put on extra weight. So exercise in any form will make you lose weight, make you happy and cheerful, and get rid of your problem. Now this can happen in three severity, like we say, very mild, that it comes and goes, but it doesn't restrict any your daily activities. So try to do all this exercise to get rid of that problem. As Bela has mentioned that she's getting on better. Very good. Now the next one is, we have done some exercises. Still we are going to do a few more while we are lying down and standing also. And other thing will come. Now, doctor has referred us to the foot specialist. The physiotherapist look after our exercises. And the foot specialist, he will tell us about insole. That put some padded sole in your shoes. And there are so many types which are available in the market. One is here, I can show you. This you can put at the shoe at the heel area. Very, very gentle, soft. You can get from any chemist, not very expensive, maybe 10 pounds. So get this. And if there is whole of the foot is involved, as I showed you the picture of whole foot, underneath is red, then you can get longer one also. Both the sides, it will be like this. Okay, this is insole. This you can get from any chemist. Try this. And if you get better with exercises and with this sole, very good. And when the condition gets more severe, then you have to see your doctor and please consult him. You are trying your exercises and it's not getting on better. You have to consult your doctor because that is interfering with your daily routine. You can't sleep, you can't talk, you are miserable. So please consult your doctor and he will do further. And there are so many treatments which has been done for this. When the condition is very severe, you know that you must have heard about injections, steroid injection. Okay, that also ultimately are given for the people who are suffering too much for too long, and that can help you for a few months and then the pain might come back again and again. So I won't be talking much about that. And then there are other therapies, ultrasound, this laser treatment they do to get rid of this pain which is at my soul. But again, coming to our yoga practice, Ayurveda, I will say, Swamiji is getting rid of this problem with various Ayurveda medicines because we believe this condition is because of our vata problem, excess wind in the body. So we have to get rid of that. And recently he is doing, Pranam Swamiji, he is doing Shringi treatment. That is like a cylinder thing they put wherever there's problem is. Any problem. Eye, ear, nose, heart, lungs, whatever. Same he will be doing Shringi treatment on your soul, putting that cylinder thing, or leeches treatment. And the people are getting better within a day or so, suffering from so many years. Please try to watch Astha and Sanskar channel and look for these treatments. Plus, they do a lot of this Bhatti treatment, all medicated. Their Ayurvedic medicines are given from the mouth, from the bowel down below, and on the areas also. So they are getting better. Now let's come back to our other asana we are supposed to do for this condition. First, I will touch that. Very simple. While standing, you can do it. Again, what we do? we are walking on our forefoot. We are walking on our forefoot. See, I'm going back at the moment on the forefoot, but make sure you're not having fall. You're walking on your toes. Walk on your toes. That's the idea. The whole action is done at your toes. You can go backward if you're very stable. Put a chair nearby. Walking on the toes. Walking on the toes. Next one is, again, lift up your heel, stand on the forefoot, like we do Tadasana. Yes? Every day we are doing Tadasana. So, but arms are down here. Only I am standing on my forefoot. My heel is up. Stay like this, depending upon your practice. 1 minute, 2 minutes, 3 minutes, 4 minutes. Slowly and slowly build up. 5 seconds, 10 seconds, 20, 31. Slowly and slowly. Standing on your forefoot. Heels are up above the ground. Yes. Very good. The next one, we are going to do chair pose. Because when you are standing for the chair pose, your feet are touching the ground tightly. They are touching the ground very tightly. See? Touching the ground very tightly. You need enough space. Come on. Chair pose. Yes? You're touching the ground very tightly and you're doing your chair pose. Stay in this position 5 seconds, 10 seconds, 20, 30 and 1 minute. Getting the extra benefit. You're doing your knee exercise also. Chair pose. And come up slowly. Again. Breathe out and go down. Bend your knees. Pull your hips out. Touch the ground very tightly. Very good. Now the next one is, we are going down. Now go down depending upon your stamina. Breathe out, go down. And again you are touching the ground with your hand and your foot very tightly. And you're getting a lot of pressure on your calf muscles. Because I want to get my calf muscle working better, not to get this heel problem. Stay like this. This is another benefits are also coming. Increase the memory, increasing the circulation in the brain. And breathe in and come up and relax. Now we'll lie down now and do some poses to get better with my plantar fasciitis, fatty ischias. In this, main thing is you're doing your, again, your ankle and the foot movement. Take your right leg up and face towards the right side. You are looking, your toes are looking towards the right side of the room. Very good. Then on the left side. Very good. Come in the center. Take the leg down. This is also going to help my knee joint also. Take the leg up, maybe 20, 30 degree up. Take the foot, toes facing towards the left side of the room. Then come in the center. Then face towards the right side of the room. Very good. Hold it for short time. Don't do in a rush. Hold is very important. Then come in the center. Now same thing goes up. Take your leg. Bring the right leg towards, over the left leg to the left side of the wall and touch the ground. And try to pull your toes towards your head, you can say. Facing up, up, and then down. Down and up. Do like this. Main action is done at the toes because my fascia is attached there to the toes. Then come in the center, slowly, down. Take the left leg up. Take it on the right side. Again, move your toes. Make them squeeze like this. Squeezing, squeezing, opening up, squeezing, opening up. Well done. The next one is, now put your right foot on the left big toe and stretch and try to pull your feet towards your face, you can say, upper part. You're giving a lot of stretching at your plantar fascia. Yes. Stretch. See? Then other one. Other one. See? The left, my heel is on the big toe of my other foot. And stretch again. The toes stretching. Very good. Carry on. Carry on. So many exercises you can do. And we are doing every day actually, without knowing the benefit. Other one is, if your body is quite flexible, hold your toes. If you can hold, I can't hold. Just imagine this is my toe and I'm pulling it up. My toes are coming towards my face, you can say. And stretch them like this. Stretch. Same thing, movement at the foot. Stretch. Stretch. And you can squeeze your toes again. If you can't touch your toes with your hand, you can do your verification by touching the bottom of your trouser and pull it up and then do movement. Simple, simple, simple. By doing all this, you are losing weight also. That is also our target, to get rid of extra weight and not to get that. So we can do some more exercises. We have done some asana particularly for that problem, plantar fasciitis. Now for the weight reduction, very easy. Take your right leg up, stretch and rotate. 360 degrees and keep it stretched. No bending of knee. If you have got pain in your knee, be very gentle. Very slowly you do it. Very slowly. And up to the level you can reach. Otherwise, go 360 degree rotation. Clockwise, anti-clockwise. To get rid of this extra weight. Take it down, left leg up, rotate. Very good. Very good. Very good. Then you can do your cycling. Cycling we are doing. You're not going out. It's very slippery. Don't take a chance. Reverse gear, coming back home. Can't go out, but coming back home. Reverse gear. Reverse. Very good. Very good. And then you can do your Pavan Muktasana also to get rid of so many problems. Nabhi Dharan, displacement of the solar plexus, weight reduction, activation of all the organs, get rid of extra wind, sideways, maybe some area is stuck in the side. Well done. Well done. Now you can do so many exercises. Your Chakki Asana, your churning and whatnot. Let's get some breath now. Relax in the Shavasana. Take a long deep breath from the nostril, exhale from the mouth. Make sure the whole body is relaxed. Shavasana. Every part of the body is relaxed. My plantar fascia relax. The whole foot, the ankle joint, the calf muscles, they're all relaxed. The knee joint, the thighs, the abdomen, all the organs of the abdomen, all relax. My heart, lungs relax. The neck, the thyroid gland, parathyroid gland, the whole face, relax. Forehead, the brain, the whole back is relaxed. I am in the state of bliss, peace, Anand. Arms are relaxed, my fingers, my palm, my wrist, the lower arm, elbow, upper arm, shoulder, all relaxed. Om, Om Anand, Anand. as time doesn't permit. Try to move your body very slowly. Take the left turn. Put your hands on each other under the head. Bend your knees. Stay for short time. Then get up slowly with the help of your hands. Rub your palms. Put them on your eyes. Slowly open your eyes. Okay, we have done enough exercises to cover the topic of the day. Now, this problem is according to Ayurveda because of Vata problem. Excessive air in the body. So we will doing pranayam, spending some time on Kapal Bharti. Kapal Bharti is the one which take away all our three dosha, Pitta, Kapha and Vata. So one should do Kapal Bharti for a long time and Alom Vilom and plus the last three like your Bhamri Pranayam, Udgit and Pranav. They are going to help us a lot for this problem. So we'll be doing we have done Bhadrika already throughout the process. The next one is, we are going to do now Kapal Bharti with some mudra. Now what mudra is required for this? To take away my wind problem. Everybody knows that, I know that. Vayu mudra. Vayu mudra is the one which is going to take away this problem of vata, too much vata in the body. Yes. So we will do Vayu mudra. Yes. Next 14 minutes, we are concentrating on those steps I mentioned. Kapal Bharti, Alom Vilom, but Bhamri, Udgit and Pranav. Yes. This is your Vayu mudra. The tip of the index is touching the base of the thumb. Thumb is resting at the index finger to take away my vata problems. So start doing Kapal Bharti at your own pace, either slowly or with medium power or medium speed. 1 stroke, 1 second. Full attention is on exhaling. Automatically we are breathing in. So let's start. And make sure the whole abdomen is moving. And take your mind to the problem you are suffering. Today's topic is plantar fasciitis. So I am taking my mind to my sole of my foot. Sole, S-O-L-E. And also my soul also, S-U-L also, my Atma. क्योंकि परमात्मा से मिलना है आत्मा को आज. चलिए बड़े प्यार के साथ, मुस्कुराते हुए, पूर्ण शरणागति के साथ, मैं तेरा तू मेरा, ये एटीट्यूड हो जिंदगी का. चलिए, the next mudra will be pran mudra. The best mudra is प्राण मुद्रा. प्राण की शक्ति होगी तो सब कुछ होगा. आई साइड भी इससे ठीक होएगी, प्राण का फ्लो भी अच्छा होगा. प्राण मुद्रा, touching the tip of your ring finger and the index finger, tip of the thumb. Kapal Bharti with pran mudra. Lift up your spine. Carry on at your own pace. The next is detoxifying mudra. Kapal Bharti is also detoxifying pranayam. So we want to get rid of these. This is actually toxin in the body, which has created my problem of plantar fasciitis. So get rid of toxins. Apan mudra. And we can do exercise also side by side to lose weight. Kapal Bharti with Apan mudra. Move your neck also to activate the thyroid gland, parathyroid gland. Double action. Kapal Bharti is also going to activate my thyroid gland, parathyroid gland. Even the vocal cords are getting exercise. Good for my heart and lungs. The major effect is on the abdominal organs. जितने भी वहाँ organs हैं. The liver, the gallbladder, spleen, pancreas. Because you know people who more suffer from this condition, plantar fasciitis, who are having diabetes or arthritis of any kind, they are suffering from this. Can be rheumatoid arthritis, gouty arthritis, or simple osteoarthritis. So, we have to get better with our diabetes also and arthritis. Apan mudra with Kapal Bharti is going to cover everything. And you know what is frozen shoulder? The same problem there. That fibrous tissues are getting inflamed. Shoulder, frozen shoulder. Then we are getting, just watch me. We are getting trigger fingers. Your fingers are bending without your desire. This is also same because there is a tendon here going from my palm up to my finger, which is inflamed. And again, this can happen when you are doing too much exercise. Too much exercise you are doing, you can damage all these things. So that's what they say, everything should be in moderation. Doing too much, maybe I have done too much of this, doing various classes. So always you have to balance yourself. Other thing can happen here, this one. Carpal tunnel syndrome is also the same. Fibrous tissues are annoyed with us, inflamed. Then tennis elbow. What people using more cleaning, too much cleaning all over, or playing tennis. So these are all the same thing, you know. So get rid of, these are the toxins which are common in the body, and we want to get rid of by doing Kapal Bharti and Apan Mudra. Carry on. This is the logic behind it, nothing more. So get better with your diabetes, arthritis, not to get that problem. Otherwise, people are suffering seriously and they can't do anything. They can't do changing of their clothes, the bath. That is a sphere type. Then you can do Apan Vayu Mudra. Again, benefit of Vayu Mudra and Apan Mudra. Kapal Bharti. Sorry, I'm moving fast because I'm leaving some time for another little topic. The next one, as I said, make sure if you're walking barefooted, as we say, you should walk barefooted in between. Don't wear shoes all whole day long. And not to wear flip-flops or your shoes without back laces. There should be some straps at the back. But again, doctor says, be careful, you are diabetic, you will get hurt, there will be ulcer. But please, please watch for these things. Take off your shoes. Don't wear them the whole day. And then walk on barefooted. But again, make sure the floor is not cold. The foot will be more jammed if you are very cold at your foot. The foot temperature should be your body temperature. And at this age, we are all getting cold hands and cold feet. So wear your socks, thick socks you should wear whole time. Even I will say if you are suffering from too much of this plantar fasciitis, in the very severe condition, they put you night splint also. So that problem doesn't occur when you are sleeping. Because this problem can occur at night because most of the people are getting symptoms when they get up. When they put your foot on the floor, they get a lot of shooting pain, stabbing pain in their heel. So they say the cause can be your mattress or the way you're sleeping even. Your foot is going down when you're sleeping. It's going down. And that's why they put night splints to give support on your foot. They give you support. They give you support on your foot so that your foot stay like this. Sorry, I'm putting my foot in front of you, but I want to show you. When you're sleeping, they put the splint, the support, so that your foot is like this, not like this, going down. Because that will create more problem. And look at your mattress. We are supposed
Dr.
to change
Kapur?
our mattress also.
Dr.
Hello?
Kapur, I've got a drop foot after a hip surgery and I have to wear a splint because my foot goes that way and it really hurts after a while.
Yeah.
So I have to wear a boot. It's a soft boot till my knee.
Or
and
boots
it
you have
keeps
to wear at night also.
Yes.
Now, let me tell you one more trick here. If you are a beginner suffering from this problem, try to wear socks at night. Now, these socks shouldn't be very, very thick, but there should be enough support in your socks so that your foot stay like that. Don't bend down, okay? Like a splint. So your socks can act like semi-splint. They're not that strong and sportive like your splint. So night splint and the boots are recommended at a very severe condition. So these are the things. So make our body warm. We know one more mudra known as Ling Mudra or Surya Mudra. They are all going to increase our body temperature. So my feet will be warm, my hand will be warm, whole body will be warm, and all the organs will be working perfectly well. So these are the mudras which are very, very important for today's topic. The next one is our Anulom Vilom. This again we have to do for a long time. To get rid of any problem, Anulom Vilom. As Swamiji says, Kapal Bharti for 2 hours, and Anulom Vilom, whole day. Whole day Anulom Vilom. If we want to get better. But the problem is we don't do. Even the yoga teachers are not doing. No, I know that. And we are suffering from lots of problems. We are suffering from lots of problems. Look at, I don't know, Varsha mentioned last night, Bunyan And then she said knee exercise. And look at her, she's so active. She's so active. She's doing all the poses. I am surprised. I am surprised. She's doing so many poses of the knee. I don't know whether she's suffering or she wanted to know about the knee exercises. Some I have covered today, rest I will do in detail later on. But the thing is, I'm surprised, Varsha, you are doing all those Vajrasana and this asana, that asana. With the knee problem, you can't do that. No. So I don't know whether you asked for your friend or somebody. The banyan also you are suffering. Very surprising the way you are doing all those poses with the banyan also. Now, let me just go over to Bhamari and then I will come back to your banyan. I did show the picture to the rest of the class in the beginning. What is banyan? So let's go on to Bhamari Prana. Anulom Vilom, just few seconds one can do because time doesn't permit. We all know how to do it. The benefits, multiple benefits. Any disease, anywhere. Next is your Bhamari Pranayam to make us happy and cheerful, get rid of all the problems. 3 times we will do. Udgit Pranayam 3 times. Pranav Pranayam. We in the seat of silent meditation. Fix your mind either on your breath or the third eye, Agya Chakra. Go on chanting the Lord name inside. Any mantra, any shabad, any dhun, carry on. We are in the state of gratitude also. Thank giving. I am never alone. I am never alone. मैं अकेला नहीं हूँ. मैं अकेला नहीं हूँ. वो सर्वशक्तिमान सदैव मेरे साथ है. उन्हीं की अपार कृपा से ये सब कुछ हो रहा है. वही हमें मार्गदर्शन करते हैं, क्या करना है, कब करना है, कैसे करना है. The Lord shows us the way how to serve the humanity. We are thankful to Almighty who gave us strength to perform today's yoga. Thank you, thank you, thank you. Raise your arms up, rub your palms, put the palm on your eyes. Feel the warmth going on your ears and the whole face. ऊर्जा बढ़ रही है सारे शरीर में. शक्ति आ रही, शक्ति. Open your eyes slowly and remove the hand. You will massage any part where you're having problem. You can take to your sole of the foot. That was the problem of the day.
Thank you, Dr. Kapur.
Yes, I will show
were
you
going
a
to
banyan
Yeah.
now. Banyan.
Thank you. Thank you.
Who is suffering banyan?
I have, but I don't know. The doctor say it's not, but it is.
Okay, you can show us your foot then. We can see that.
I am suffering from bunion.
You are not suffering. You are suffering or not suffering?
I'm suffering.
You are suffering from
Banyan.
banyan.
Is that a banyan or not?
Bunion, the toe, my finger coming on top of the toe.
No, that's not banyan.
Yeah, bunion, देखो.
It's more arthritis, isn't it?
Not arthritis. It's bunion. It's my finger like this. It's bunion.
Banyan, where your toe?
Huh?
Varsha, have you got banyan?
मैंने ये पहना है.
Oh, wow.
आज
Banyan.
ये पहना है, लेकिन इससे अच्छा हो रहा है. उसकी कोई एक्सरसाइज तो नहीं होती, पता नहीं.
इसकी कोई खास
लेकिन
एक्सरसाइज नहीं है.
इतना
इसमें
इतना
rest
नहीं,
is
इतना
most
खराब नहीं है.
important
It's
because
just
the
the
typical
beginning.
sign and symptoms will be.
Varshaben, I've got the same as well because it's terrible when you
तो ये
wearing
क्यों हुआ? कभी सोचा ये क्यों हुआ?
shoes, tight shoes, pointed shoes.
Tight
पहले
shoes, fashionable shoes.
young में
Now
पहना
you
था.
can see this. Can you see this? The banyan.
मैंने कभी नहीं पहना.
बनियन देख लो.
बनियन को देखा.
बनियन देख लो, ये बनियन है. The right
अभी
side one.
ठीक हो रहा है.
Alex Valgus. मैंने दिखाया
Can
आपको.
you have a look at it again, the banyan thing?
ठहरो ठहरो, ये आएगा तो.
Thank you.
अरे भैया, I am also learning. Where is the banyan? Here is the
Varshaben, does
banyan.
it hurt you?
नो नो, कुछ नहीं होता है.
The same thing with me. It doesn't hurt.
But I started
बनियन
wearing this
आपके
one.
जो shoes
It
थे,
helps.
they were very tight, fashionable shoes, very narrow forefoot. Very
Pointed.
narrow forefoot. That caused the problem.
Hmm.
That has caused the problem. इसके लिए तो यही है कि आपको अगर ज्यादा सीवियर है तो you have to go for the surgery. Otherwise splint जो आपने डाले हुए हैं और
It's
उसमें
just the
यही है कि
beginning.
थोड़ी बहुत एक्सरसाइज कर सकते हो depending upon the severity. If it is a mild, you can do again your movement. और इसमें कंडीशन है क्या by the way? उन्होंने बताया आपको? What is the problem?
They don't.
अच्छा, उसमें ये है.
मेरे
अभी
को
छोटी पिक्चर में देख लो, अच्छी तरह नजर आ रहा है.
मेरे को पेन
आ
नहीं
रहा है
होता.
नजर? आप ध्यान से देखो फुट को. ध्यान से अब देखो, अब बड़ी अच्छी पिक्चर आ गई. थैंक यू. मेरे को मत देखो. ओके, ये फुट को जो राइट साइड पे है जिसके ऊपर लिखा हुआ है हेलोस वेलगस, इसका जरा बोन्स को देखो. आप बोन्स को देखो. वहां बोन है, 5 है हमारी मेजर बोन नोन एज मेटाकार्पल. टार्सल टार्सल
Tarsal.
कार्पल हैंड की हैं, फुट की होती हैं टार्सल. जो सबसे बड़ा बिग टो है उसकी जो है मेटा, ये है मेटाटार्सल. वो देखो हो गई है आउट ऑफ डिसिप्लिन, मिस अलाइनमेंट. उसकी अलाइनमेंट ठीक नहीं है, टेढ़ी पड़ी है ना. वहां देख रहे हो, जो बड़ी बोन है ऊपर जो है छोटी बोन है, उसके आगे है मेटाटार्सल, लार्ज बोन ऑफ द बिग टो. जो होगी उसकी अलाइनमेंट खराब हो गई है.
Yeah.
वो टेढ़ी है. टेढ़ी है, टेढ़ी है, इसलिए वो प्रॉब्लम हुई, वहां पर स्वेलिंग हो गई है और वहां पर थोड़ी स्वेलिंग नीचे भी हो जाती है, साइड पे भी हो जाती है। ये एरिया जो था वो इन्फ्लेम्ड हो गया, इन्फ्लेम रेड हो गया, इसलिए दर्द होती है। और जैसे बताया उसने, जिसको ये प्रॉब्लम है वो स्प्रिंग डाल के बैठी है, ठीक है, तो उसको वो करेक्ट कर रहे हैं। अगर स्प्रिंग से ठीक हो जाएगा तो ठीक है, नहीं तो दे हैव टू डू सर्जरी।